I was originally a physical therapist for 4 years, and going through medicine, I got to see many aspects with athletes and total joint replacement patients. I got into many surgeries and then kind of got inspired by that to go back to medical school. My experience as a physical therapist has helped really shape my practice in preoperatively and postoperatively and making that process easier for patients. Medicine's a continually changing field. At Colorado Joint Replacement, my partners and I do top-edge cutting research, and we are in an attempt to find better outcomes and care for patients each day. Prior to hip and knee replacement surgery, most patients have failed conservative interventions. Those consist of things like ice, elevation, NSAIDs, which are things like ibuprofen, Aleve, also physical therapy and injections of potentially a steroid into the knee. In our practice, we typically have an extensive preoperative process where we educate our patients, which includes both online support as well as in-person support prior to knee or hip replacement. What makes our surgeries a success postoperatively is our extensive preoperative education. We really guide the patient through the process. The surgery is very quick and brief, and their hospital stay is typically short. Physical therapy starts after that, which can be fairly intense, particularly for total hip and knee replacement patients. We help guide them through their process with preoperative education, also help taking their medications, and lastly, we're always available by phone or in person for them to come in if there's any issues. So each surgery for me is individualized. I treat every patient like it's my own family member, and I always tell them just put their trust in me and let me treat their hip or knee like it was my own. I think it's very important for patients to understand having a hip or knee replacement is not the end, it's really the beginning. They've been so long with pain and suffering sometimes and not being able to do their recreational or activities of daily living. It's really a new beginning for them.